Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome to this presentation on managing gastric contents aspiration during dental procedures. The high acidity of gastric material causes serious respiratory problems, including necrotizing pulmonary tissue and respiratory distress syndrome. The risk of gastric aspiration is higher in patients with a diminished gag reflex, often caused by sedation, unconsciousness, or topical anesthesia in the oropharynx. Recognizing and reducing these risk factors is essential for preventing complications. Symptoms of gastric contents aspiration include rapid breathing, wheezing, tachycardia, hypotension, and cyanosis. This box refers to the signs, symptoms, or clinical presentation that occur as a result of gastric contents aspiration into the lower respiratory tract. And these are the signs and symptoms of ongoing vomiting, that is just before actual vomiting. If a deeply sedated or unconscious patient begins to vomit, immediately place them in a head down, feet raised position and turn them onto their side to encourage oral drainage of vomitus. Use high volume suction to assist in removing vomitus from the oral cavity. If gastric material is suspected to have entered the lower respiratory tract, contact emergency assistance immediately. Provide supplemental oxygen and monitor the patient's vital signs closely. If possible, gain venous access to administer crystallized solution, for example, normal saline or 5% dextrose in normal saline, to help treat falling blood pressure and allow emergency technicians to administer IV bronchodilators if necessary. Immediate transportation to an emergency facility is mandatory for patients who have aspirated gastric contents. This flow chart shows the management of vomiting with possible aspiration of gastric content. This flow chart will be discussed in next video. Now let's discuss the important points to remember. Aspiration of gastric contents into the lower respiratory tract can cause serious respiratory issues. Particulate matter physically obstructs the airways, but the high acidity of gastric material is more problematic. The low pH of gastric juice quickly damages pulmonary tissue, leading to respiratory distress syndrome. Patients with a diminished gag reflex due to sedation, unconsciousness, or topical anesthesia are at high risk. Initial signs include tachypnea, that is rapid breathing, and wheezing. Further complications include tachycardia and hypotension, and eventually cyanosis and respiratory failure. For a deeply sedated or unconscious patient who begins to vomit, immediately place them head down and feet raised, turning them to their side to encourage drainage. Use high volume suction to remove vomitus from the oral cavity. If you suspect gastric material has entered the lower respiratory tract, contact emergency services immediately. Administer supplemental oxygen and monitor the patient's vital signs. If possible, establish venous access to administer IV fluids to help treat low blood pressure. Emergency technicians may need to give IV bronchodilators. Transport the patient to an emergency facility immediately. Prompt recognition and management of gastric contents aspiration during dental procedures are crucial for patient safety. Key steps include positioning, suctioning, and containing emergency assistance along with advanced management techniques. Immediate transportation to an emergency facility is essential to ensure the patient receives appropriate care. Thank you. Wish you best of luck.